Hypertension is a medical term that means high blood pressure. Hypertension in people is related to several factors, including a stressful lifestyle. Not all of the causes of hypertension in cats have been identified, but it does not appear to be related to psychological stress. Two major causes of feline hypertension have been identified. One is kidney failure, and the other is thyroid disease. However, a few cats develop the primary form of hypertension, which means there is not an underlying disease problem. The most dramatic clinical sign of feline hypertension is sudden blindness. This occurs because high blood pressure in the vessels of the retina in the back of the eye causes the retina to detach. Affected cats have wildly dilated pupils that do not constrict when exposed to bright lights. These cats run into objects because they have lost their vision. Blood pressure is measured with a medical device that can detect blood flow in the arteries. However, cats have very small arteries compared to people. Therefore, standard blood pressure equipment used on people will not work on cats. Many veterinary practices do not have this specialized equipment and may have to refer the pet to a specialist. There are several drugs that are very effective in treating hypertension in people. However, no drug is approved for feline hypertension. Research has been done to determine the most effective drugs for the cat. Several have been found that will lower cats' blood pressure effectively and safely. Ongoing research will likely find others. If a cat becomes suddenly blind due to a detached retina, a medical emergency exists. If the retinas remain detached for more than a few days, they probably will not return to their proper position and become functional again. The key to successful treatment is a quick diagnosis and early administration of medication to lower blood pressure. If blood pressure can be lowered quickly, many cats that have lost their vision regain some or most of their sight. Therefore, it is important that cat owners be observant for signs of sudden blindness, such as walking into objects and dilated pupils that do not constrict when exposed to bright light. If the cat has kidney or thyroid disease, it is also important to treat those conditions aggressively. Because the underlying disease that caused hypertension must be controlled, long-term treatment success depends on it. Please ask one of our staff members if you have any questions.